In a post-Roe country, women are faced with new challenges seeking reproductive health care. Just this week, the Supreme Court heard a case involving the abortion access pill mifepristone, which could further change the reproductive landscape. A new report looks at the lengths doctors are having to go to provide the best care possible while staying within the bounds of the law. I spoke with Michelle Ehrenberg, the executive director of LIFT Louisiana. Take a look. First off, I want to say thank you so much for joining us.
Thanks for having me.
So we're going to jump directly into this report. So why did you decide to collaborate with other groups involved with this project to study the results of the Dobbs decision?
Well, we thought that it was critically important because what we were hearing more and more from both patients and physicians was that the abortion bans were having an impact on the way that pregnancy care was being provided in the state of Louisiana. There had been multiple news stories of patients not receiving timely access to care, even having to travel out of state to receive the care that they needed. And so we thought that it was really important in this moment really to undertake the research and actually document the impact.
What were the key findings and how did that affect women's health care currently?
Well, I think one of the things that is really important to note is that the abortion bans have really had an impact on the provision of pregnancy-related care. So this is not necessarily even focused on people who are seeking abortions, but actually people who are carrying wanted pregnancies that are dealing with pregnancy complications and that are finding that care being delayed or even denied in some circumstances. And so I think that's one of the really critical findings in this report. And also just the amount of confusion and fear that physicians feel as it relates to what care they can provide, at what point they can provide care, and it seems to have had a very sweeping impact on what would normally be sort of best standards of practice in pregnancy care because there's so much fear and uncertainty about what physicians are allowed to do or not allowed to do under the current law.
I did notice that the report did focus highly on physicians and healthcare providers. So can you give me an example of a situation where a healthcare provider may be afraid to give some sort of level of care that maybe they would have given before the Dobbs decision?
Yeah, so we heard a lot from physicians. Almost all physicians talked about or expressed situations in which either they themselves or colleagues were delaying access to care. So, for example, there's a story that's recounted in the report about an ectopic pregnancy situation in which it was very clearly an ectopic pregnancy, but the care for that patient was delayed and they were asked to come back, and because they just wanted to make absolutely sure that they could terminate the pregnancy without the repercussions or being perhaps misunderstood to have provided an abortion in violation of the law.
So there's a lot of fear and anxiety around, okay, I could possibly be penalized for performing X, Y, Z.
Right, exactly.
And so, I mean, how did the findings in this report compare to other states that have passed similar legislation?
Well, I think that what this report shows is what's happening in Louisiana for sure, but we think that this is probably just a microcosm of what's happening around the country and other states which have banned abortions. And our hope is that other states will undertake similar research so that we can get a better picture of the impact, across the nation of these abortion bans. But we did choose to focus here on Louisiana because we have some of the most restrictive abortion bans in the state with very, very, very limited exceptions. And even in the circumstances in which there are exceptions, it's very unclear as to when a provider can perform a pregnancy termination, otherwise known as an abortion, and still be within the bounds of that law.
Well, there were a lot of recommendations that were presented in this report to help with these poor health outcomes. I guess, in your opinion, which one is the most important that you think Louisiana should adopt?
Well, I think there are several that would address, I think fundamentally just repealing the abortion bans would be the most important thing. But we also recognize that there's not a lot of political will at the Capitol to do that right now. But there are several proposals, even in this legislative session, that would make modest changes to the existing abortion bans that would give medical providers a little bit more discretion and sort of untie their hands to make decisions in the best interest of the care of their patients when it comes to miscarriages or other serious health complications.
And there is another thing that I wanted to ask that was in that report. One of the report's findings is that doctors are having to resort to much more invasive surgical options like a C-section, whenever other procedures could have had the same outcome with far less risk to the mother. Is that something that is true in other states, or is that something that's focused mainly in Louisiana?
We're not really sure, but this actually was one of the most surprising findings for us in doing this research. And there's one particular story that's recounted in the report, but we actually heard 3 or 4 different stories from physicians in which the provider opted to perform a C-section rather than perform a procedure that would be much less invasive, what's usually called a dilation and evacuation procedure, which is the exact same procedure as an abortion. And so there's one story that was relayed to us from a physician in which a patient's water broke at 20 weeks, and so the pregnancy was no longer viable at that point. And if the patient had been asked or forced to carry that pregnancy further along, it really would have put their health and life at risk. And so normally a doctor would consult with the patient and give them several options. One would be the dilation and evacuation procedure, or they could induce labor and have a vaginal delivery. But the last and most significant option would be a C-section, which is severe, very serious abdominal surgery and has a lot of implications for future pregnancies. But yeah, we heard 3 different stories of situations in which the patient wasn't even being given an option of what to do in that circumstance.
All right. Well, thank you so much for sitting down with us. I appreciate it.
Thank you.